Hi, this is Dr. Delaney, and first off, check out her shoes. All of our patients are awesome. All right, so for this patient here, we are injecting her masseters. Okay, so at nighttime she clenches, she grinds her teeth, and it's causing a little discomfort. So we're going to inject some botulinum toxin. Specifically, we're going to do Daxifier for her today, so it'll last a little bit longer. And we're going to inject it right into the muscles to help relax and improve her grinding at night. Okay, so if you come in a little closer, what we typically do is I'll have the patient clench down for me, and we can kind of feel how thick that muscle is. Okay, relax, clench again. And so based on how big that muscle is, we'll decide how many units to use. Okay, relax. Clench for me. She's been doing it for a while, so she knows when to clench. Zoom in on her. Mm-hmm. Have her flex. Can you flex? So you can see the outline of the muscle here. So we're really injecting primarily the more superficial half of the masseter muscle. I'll get a little bit of the deep one, but this will really help with the clenching and then the pain. And then also, you could have a little bit of a slimming effect as well. So for people who have really square jaws, we can assess you to see how big your masseters are, because if your masseter muscles are really big, we could actually use Botox to help you slim down a little bit. All right, clench for me. Okay, relax. Clench again. Okay, relax. Clench one last time. Okay, good, relax. All right, Stephanie, can you describe what does it feel like?
I wasn't prepared for this. Yeah, I mean, it's just like a little poke and just a little sting for a second, and sometimes you can feel it when it gets a little bit deeper, but it's really not too bad.
Not too bad. It's a little pressure sensation, right?
Yeah.
Okay, relax. Clench again. Okay, good. Okay, clench again. Okay, relax. Clench one last time.